Each year, over 100 million people visit the emergency room in the United States alone. Many of these cases involve things getting stuck inside the human body. We're going to look at three of my patient cases today. Some may involve some pictures, so viewer discretion is advised. Before we get started, if you're a fan of strange, mysterious medical cases and even a little paranormal, then you're in the right place because that's what we do here. We try to load 2 to 3 videos per week. So don't forget to click the like and subscribe button and activate all the notifications so you'll see whenever our videos come out. So let's get started. In 2007, I was still doing medical training, and I decided to do a colorectal surgery elective. Didn't seem like it was going to be much fun to begin with, but once I got into it, I found out it was pretty interesting work. Around this time, there was a patient we'll call Eric that was living in the suburbs of Atlanta. He was a big fan of football and one weekend had invited his friend over to drink some beers and watch the football games. While they were going through this day, drinking lots of beer, watching lots of football, having a pretty good time, the day started to wind down, and Eric looked over to his friend and had an idea. By this point, I'd been in the hospital for about a week, studying, living, eating, sleeping in the on call room, just waiting for cases to come in. So late one evening, we got the call to someone had come into the emergency room losing a lot of blood. So I quickly made my way down to the emergency room so I could start to analyze the patient. Now, I'd noticed right away the nurses didn't want to give me the chart. They didn't want to tell me anything about the patient. They just wanted me to go in and see the patient. So when I walked into the room, the man was lying face down on the gurney and had a sheet draped over him. So I walked over, introduced myself, and said, "You mind if I look under the sheet?" He said, "Sure, go ahead." So I lifted the sheet up, and there, sticking out of his backside, was the business end of a toilet brush. So I was a little shocked, of course, but after being through the emergency room doing many kinds of surgery, I've seen a few weird things like this. So I just asked him what happened. I expected to get one of these. I was cleaning and I slipped, but it didn't. He came right out and just said, "We were having a lot of beers, we were watching football, and at some point I just said, hey, I've got an idea." So Eric convinced his friend to insert the handle portion of the toilet brush into his lower digestive tract. At some point, Eric wasn't getting the expected experience, so he's asking his friend to get it out. Now, you have to understand that Eric didn't just go and buy the 99-cent toilet brush. He went all out to the big bath stores and got the one with the hook on the back so you could hang it up to dry after you've completed your work. So at some point, this hook part became involved with Eric's anatomy of his lower digestive tract and became stuck. So Eric's friend kept trying to pull it out, and with one big final effort, Eric felt a rush of warmth down the back of his legs and heard the door slam behind him. He turned around to see his friend running down the street. Now, I was still trying to be professional at this point. I was concerned about Eric. The digestive tract is highly vascular, and any kind of insult like this can rapidly become fatal. So I was asking him, was he conscious when the paramedics arrived? And he told me he didn't call the paramedics. This is too embarrassing. So I was kind of curious, and finally, I was like, "How did you get to the hospital?" Well, he directed my attention to a robe that was laid over a chair. And apparently, he had wrapped a robe around himself and drove to the hospital, somehow sitting at an angle to not disrupt his toilet brush. So I finally gathered all the information I could. We were able to stabilize the patient, moving on to surgery. Going inside, we had to remove nearly a foot of his intestine. Now, when a big surgical procedure like this occurs in the digestive tract, normally what we'll have to do is put an ostomy, which is an opening for the intestine on the outside of the body. The other part is usually clamped off into a blind pouch. And so the patient will just stay in the hospital for a while, monitoring his vitals, allowing him to have this bag to empty the contents of his intestines until the healing process is starting to occur. And we'll take him back into the operating room, put his intestines back together, and then let him come back to the hospital room so that he can rest and prepare to go home. Now, I was checking up on him finally when he was able to leave. And while questioning him, making sure the wounds were healing appropriately, making sure that his pain is under control, that he's adequately nourished and hydrated, I hear a knock on the door behind me. Now, to this day, I wish I had stayed to listen to this conversation, but I didn't. So in came Eric's wife and 2 children, and I quickly exited the room. Cynthia was 28 years old. She'd recently gotten married, lived just outside of Nashville, Tennessee, in the US. One night, she and her husband came to the emergency room because Cynthia was suddenly having severe abdominal pelvic pain and she was unable to urinate. After her arrival, we went through the full scope of finding out what was wrong with her, doing our full review of systems. Everything appeared normal, no fever, just this immense pain and the inability to urinate. We asked if anything had happened recently, trauma or any kind of other illness, and she had no contributing factors at all. Just this pain came on suddenly. She hasn't been able to urinate for about the past 12 hours, and the pain was really starting to grow. Now, if you're unable to urinate, you are at risk for a bladder rupture or possible kidney damage. We started doing some CT scans, and we saw it appeared to be a foreign object in her urinary bladder. So there was a concern maybe of a cancer or some type of stone that had gotten stuck in there. So we called for the urology to come down and run the scope and see what they could find up in there. While we were waiting for urology to come down, I noticed that her husband was pacing in the hall and acting a little anxious. So I tried to discuss what was going on with her and try to comfort him a bit. So during our discussion, I noticed that the husband was beginning to become more and more anxious and acted as though something was bothering him. So I started to become suspicious that perhaps he had done something to her or knew something he wasn't telling us. So I started pushing him for answers. Eventually, he started to talk about their strange sex habits. So they discovered some months prior that during the act of sex together, that she seemed to enjoy the act more if something were inserted into her urethra. Urethra is a tube in males and females that empties the urine from the body. So they tried several different things before they finally found one thing that worked perfectly. And that one thing was the tip of a carrot. So he would insert the carrot into the urethra and it would make that end moment a little more pleasant for her. Unfortunately, during one of these occurrences, the part of the carrot had broken off inside of Cynthia without anyone really realizing until she started to experience pain. And that's when she came to us. We found that the tip of the carrot had broken off and gotten stuck right where the bladder empties through the urethra. So urology finally came down. They were able to run the cystoscope up into the bladder, retrieve that portion of the carrot. Cynthia suffered no long-term effects from this, but hopefully she learned to stop putting things where they don't belong. Byron is a 63-year-old man that lives in the European countryside. He presented to the emergency room one night because he was having some extreme abdominal discomfort. After the initial workup, there didn't seem to be anything that was abnormal. He had complained of a little bit of constipation for a while and had even passed a little bit of blood that was kind of concerning, so he decided to have it checked out. The attending physicians decided to do some CT scans to see if they could find the root of his pain. The results of the CT scan showed a fairly large mass in his abdominal pelvic region. So there was immediate concern that this could be cancerous in nature. So he sent out for additional tests. All of his blood work came back normal. When these physicians had used all of their options, they finally contacted me for a consult. After looking at the CT scans, I asked if they had done what we call a digital rectal exam, which is just where you use a finger to determine if there's anything just inside the rectum that could be causing the problem. They stated that that was the one test they had not done. So once they did that, they contacted me again and thanked me for my time and said I was no longer needed because they had found the root of the problem. What appeared on CT scan, which could have been a tumor growing from the prostate gland or a tumor coming from the digestive tract, turned out to be neither one. When doing the digital rectal exam, the attending physician found a cucumber, and it was a very large cucumber. The patient was actually very proud of his cucumber and talked about how he had spent months growing it, but had forgotten where he placed it. So after some struggles and some unique techniques, the cucumber was finally retrieved. The patient was then released with no further complications. So that's it for today. I wanted to thank you for watching and hope you enjoyed it and got something out of the video. Don't forget to click like and subscribe so you'll know exactly when we put out new videos. See you next time.